Welcome back to Vision Wellness Zone, where we're all about bringing clarity to your eye health, without the hype and without the headlines. Ever been bothered by those little specks, threads, or cobweb-like shapes drifting across your vision? Those are called eye floaters. And if you've ever searched for answers online, chances are you've stumbled across some pretty wild claims. Maybe even headlines shouting that eye doctors are hiding a secret cure. Here's the truth. A lot of what you hear about floaters is simply wrong. And worse, believing in unproven cures can be risky, especially if it keeps you from getting the care you might actually need. Let's bust the biggest myth right now. Floaters are not caused by toxins, parasites, or liver problems, and you cannot flush them away with herbal eye drops or detox diets. There's no scientific evidence to support these claims. So, what's really going on when you see floaters? Inside your eye is a clear, gel-like substance called the vitreous humor. Think of it like the jelly inside a donut. As we age, typically after age 40, that jelly-like substance starts to liquefy and shrink. When that happens, tiny collagen fibers in the vitreous can clump together, kind of like strands of jelly sticking to each other. These clumps cast shadows on your retina, the light-sensitive layer at the back of your eye, like a movie screen. And those shadows, that's what you see as floaters. Those drifting specks, squiggly lines, or cobweb shapes that seem to move when your eyes move. This process is called Vitreous Syneresis, and it's a completely normal part of aging, just like getting a few gray hairs. Floaters are even more common in people who are nearsighted, have had cataract surgery, or experience trauma to the eye. For most people, floaters are harmless. Yes, they can be annoying, but they're generally nothing to worry about. But, and this is important, not all floaters are benign. If you suddenly notice a shower of new floaters, like someone shook a snow globe inside your eye, or if you see flashes of light or a shadow or curtain coming over part of your vision, it could be a sign of a retinal tear or detachment. That's a medical emergency, and you need to see an eye doctor immediately to protect your vision. In these cases, floaters are more than a nuisance. They're a serious warning sign. Now, it's completely understandable why people look for natural cures. When something is persistent and distracting, we all want a quick fix. But despite what you might read online, eye drops, supplements, or detoxes won't dissolve floaters. The structure of the vitreous doesn't respond to those kinds of treatments. There are medical options for severe cases. A procedure called vitrectomy can remove the vitreous gel entirely, and laser vitriolysis can break floaters apart to make them less noticeable. But these treatments carry risks and are usually reserved for people whose vision is seriously affected. For the vast majority of people, the best treatment is actually time. Your brain is remarkably good at adapting. Over weeks or months, it starts to filter out floaters from your conscious perception. This process, called neuroadaptation, means floaters often become less noticeable, even if they don't completely disappear. So, yes, floaters can be frustrating, but for most people, they're a harmless part of aging. Now that you know what causes them and when to take them seriously, you're better equipped to manage them and to steer clear of misleading or dangerous misinformation. If you found this video helpful and want more clear, science-backed insights into your eye health, hit that subscribe button and turn on notifications so you never miss a new episode. At Vision Wellness Zone, we cut through the noise and bring clarity to your vision. Thanks for watching, and we'll see you next time.